Where are you experiencing your pain?
On the inside of my leg.
Which leg?
My left leg.
When did it start hurting?
Last Sunday.
On a scale of 1 to 10, what is your level of pain?
7 whenever I'm planting my foot to strike the ball, and a 5 whenever I'm walking on it.
Have you been continuing to play on it?
Yes.
What did you do after the game?
I went to the athletic trainer and she told me to use ice and referred me to go to you. Go up against my hand. Okay. Yeah. Yeah. And then. Okay. So with flexion, that was a grade 2 out of 5. That was a 2. Then with extension, when I was going like this, that was a 4. When we were going up against this, that was a 3. And we were up against this, that was a 4.
All right. Please.
Okay. So
That's not yes or no.
Can you stop?
No, it feels weird.
We don't have a whatever it's called, the thing you measure with, goniometer. So I'm just gonna show you what hip flexion and extension is. Scoot up.
Ah! I didn't wipe down that. Is it sticky?
No, it's not.
It's sticky.
Okay. So with hip flexion, we're gonna have this. Okay, Nick? I would put it right on your hip.
All right.
The arm would be up here, and the one that measures it would be right here, and you'll move up your leg as far as you can.
Okay.
Okay, so do that.
I don't know how to go.
Okay. So that was 93. I would say that was 93. And then we would do abduction and adduction. So with adduction, Nick, I would put it up here.
Yep.
And you would move in
This way?
this way. So you have it up here, and you'll move it because you're adding.
All right.
So do it. Good. Put it down.
Thank you.
Then with abduction, you'll be going this way.
This way.
So you can do that. That's abduction. So then I'll have you switch over this way. And
That's
then
fun.
with external rotation, no, you should sit.
Oh.
So with external rotation, I would put it. Sorry. The arm would go right here, and the one that moves would be right here, and you move it in this way as far as you can. Okay. And then internal rotation, you go this way, again, arm up here, the one that moves down here, so do that. Okay. And then all of the measurements for that, flexion was 93, internal rotation was 40, same with external rotation, abduction was 28, and adduction was 25. Okay, so we're going to do the 90-90 test, okay?
What's that?
Lay down on your back and have your foot up like this. You can put your hands right here. Then move your foot up as far as you can. Okay, that's a positive. Over test. I want to have you lay down on your back first. Then get on your side. Then I want to take your foot back and tell me if it hurts. Good?
Yep.
Great. That's good. Okay, now we're gonna do something called the Thomas test, okay? So you're gonna like lay back,
All right.
and you can hold on to your leg like this. So, lay back. Okay, so here's the thing. If you would have passed it, this leg would have stayed down. So since it came up, it's gonna be a positive. Okay, now I want you to get on your stomach.
Making this a workout for me.
Alright. Bring this back.
Don't make grab it.
No. Alright, you're good. You passed. So, based on our assessment, you have a grade 2 hip flexor strain, which should take 3 to 6 weeks to heal.
All right.
So here's the plan. Right away, you're gonna apply ice to the area 20 to 30 minutes every day. For every like 3 to 4 hours, you do 20 to 30 minutes for about 2 to 3 days, continuously doing that, or until the pain starts going away.
Alright.
You're gonna start doing physical therapy after the pain subsides for about 6 weeks. And then for those 6 weeks, you're gonna do it 3 times a week.
Alright.
So then obviously you're gonna stop all activities, no soccer. Okay, we're gonna put you on crutches for about 3 weeks, and then when you're at home, you're gonna ice, you can compress and rest the area. Stay off of it. That's why we're putting you on crutches and having you stop all activities. So I'm gonna recommend you to take an anti-inflammatory medicine, so like Advil, to help with the pain and the swelling. And then for long-term goals, so I'm hoping after the 6 weeks, after rehab and stuff, that your pain, obviously we're hoping it will be at a 0. And that swelling will be gone along with the bruising that is there. And that you'll be able to go back to your activities. And then with the short-term goals, in 2 weeks, I hope, planning that your pain will be from a 7 to a 4. And then swelling will start to go down after that time, and bruising will be at minimal. It will still be there, but it won't be there as much. And then what we're planning on doing is we'll see you back in 3 weeks in 3 weeks to check in and see if you still need the crutches, and we'll see like your progress and see if you hit those short-term goals. And then again at the end of the 6 weeks, at the end of rehab, so we can see if we can clear you. Obviously, you should be icing for the 20 to 30 minutes. Keep on doing that and what I've mentioned in the intermediate training. With your rehab plan, again, like I said, 20 to 30 minutes of icing. This should help reduce the pain and the swelling. Do this for every like 3 to 4 hours. So after that time, so you ice it, then like 3 to 4 hours goes by, ice it again. And then, like I said, compress the area. Get like an ACE wrap, a body compression sleeve that you can put on it, and you can compress it while icing it. That'll help a lot. And then obviously this should be done before you start doing your rehab in the 3 weeks. Okay, so with your rehab exercises, I want to show you some stretches that you can do. Okay.
All right.
So first one is called the hip flexor stretch. So you're gonna kneel on both of your knees. And then bring your right foot forward and then stretch it. You should feel it in your hip flexor stretching. So with that, we're gonna have you hold that for 30 seconds and then repeat that 3 times. Okay?
Okay.
So then the next one is a quadricep stretch. You do this before you stretch for soccer. So stand up and bring your leg up to the back of your, yes. And hold that 30 seconds and repeat that 3 times as well.
Oh, I should do it with my left. Shouldn't I?
Yes, you can do it both. So then the next one is the heel slide. So you're gonna sit down. And yes, sit down with your legs straight in front of you. And then you're gonna slowly slide the heel of your injured leg towards your butt by pulling your knee to your chest as you slide.
So,
Yep. And you are going to do this, and then return to straight position. And you're gonna do that 20 times. You got it?
got it.